Hi, I'm Gary Campbell, President and CEO of Centura Health. I'm so glad that you've joined the Centura Health family. In the next few minutes, you'll hear about the depth and breadth of our organization. And while we serve more than 500,000 Coloradans each year with the latest healthcare systems and technology, it's the way we serve that touches so many people's lives. Our mission is to extend the healing ministry of Christ and nurture the health of the people in our communities. That's a bold statement, and it implies an extra level of respect and compassion, along with the medical expertise you expect from us. During the next few minutes, you'll hear from several Centura Health associates. But first, I'd like you to meet Brian, a patient that our team had the privilege of serving. His story demonstrates the kind of experience we strive to provide every day.
I had owned a construction company in Denver for 25 years and had recently sold it, and I was looking forward to spending more time with my children while they were growing up. And something happened one night that changed the rest of my life. All of a sudden I just got up and I felt a pain in my upper chest. I said, that's unusual. And then I started experiencing other symptoms like cold sweats. Once I decided to go to the emergency room, I chose to go to Littleton Hospital because it's my neighborhood hospital. After I entered the emergency room, I said, gee, I'm having some chest pains. And I was amazed at how 5 of the emergency room staff surrounded me immediately.
Hello, sir. How are you feeling today?
It was very professional.
The doctor saw that the EKG was good, and so he recommended doing a CAT scan.
And the CAT scan showed that he had a AAA, an abdominal aortic aneurysm. And that's very serious.
They said, we know what's wrong, we know what's wrong.
And we realized that we had to get him to Porter Hospital as fast as we could, and we called Flight for Life to take him there.
I remember thinking at the time, why is Littleton sending me to Porter Hospital? Why would they send me to a competitor? And then I found out later that they're part of the same family.
The benefit of a large organization and the fact that Centura is statewide is terrific because there are certain hospitals that have an expertise in certain areas, whether it's neurosurgery, whether it's trauma, whether it's spine care, oncology, pediatrics, whatever, name it. And you can take their expertise and transport it to your own facility so you don't need to reinvent the wheel.
Centura Health is the largest healthcare delivery system within Colorado. 1 in 5 citizens of Colorado utilize Centura Health services. We have 14,000 associates. We are a $1.6 billion company. Over 6,000 physicians are affiliated with Centura Health.
It's important for associates in Centura Health to understand that we provide the highest level of medical services in almost every service line that can be found in medicine today.
For example, last year, Centura hospitals delivered close to 11,000 babies.
Last year we had over 330,000 emergency room visits.
Every year, we admit more than 80,000 patients to our hospital systems. We have 13 hospitals across the state, as well as numerous clinics, medical centers, and physician practices. These include medical and ER services in mountain communities and even major ski areas.
Our Ask a Nurse program takes over 140,000 calls per year statewide. We assess the caller's situation and refer them to the appropriate level of care.
Flight for Life is made up of 4 helicopters based throughout the state of Colorado, as well as 3 airplanes such as the one that's behind me, as well as critical care ground transport ambulances.
So Centura Health is much more than a hospital system. We extend care beyond the hospital walls. In fact, we have a whole division, Centura Health at Home, that cares for more than 60,000 patients and residents each year before they go in or after they're discharged from the hospital. Centura Health at Home is in every community in which we have our hospitals. We offer home care, medical services, including end-of-life care such as hospice and palliative care. And throughout our 7 senior living communities, we offer more than 1,200 residents a place they can call home.
You know, what's rewarding for me is the relationships I develop with my patients. Some of these folks I've been seeing for weeks or months or even years, and it's just a different nursing relationship when you're caring for people on the long term.
And so together as a team, whether it's in the hospital or outside the hospital, we are providing and supporting for patients and their families.
I thought, this reminds me of 007. I'm flying in a helicopter off a roof.
I was one of the flight nurses working that night with Brian, and we got him from Littleton Hospital to Porter Hospital in about 7 minutes.
I was the cardiothoracic surgeon on call that night for the Centura system in this area. Brian's a good example of the integration necessary to get a good outcome in a complex problem, where while the helicopter was in the air, everyone was already in their cars on their way to come in and treat him immediately.
They diagnosed me accurately and quickly. Without that, there's no question that I would not be here today.
Centura Health is a faith-based organization. Our mission is to extend the healing ministry of Christ, to care for those who are ill, and to nurture the health of the people in our communities. And so, as we serve our patients and as they experience our care, we want to be sure that they know that they're not only cared for, but cared about, and that they receive the same compassionate care that Jesus provided to those that he served.
Well, I think the most fulfilling part of what I do is to see how I'm able to help calm the fears for patients and families as well as staff. Oftentimes I meet people on one of the worst days of their whole life, and it's important for me to be a non-anxious presence at that moment for them.
One of the most wonderful things of being a member of the Centura Health family is that we can treat individuals as whole people. And what I mean by that is that being faith-based allows us to look at the mind, body, and spirit and treat the entire person, not just the condition.
We want to incorporate our values in the decisions we make. So we developed a specific process to do that. It's called the VIA, Values Impact Analysis. Our goal is to be able to clearly communicate our decisions in a way that people understand that we used our values in making those decisions.
It feels that every decision that they make is done with a lot of integrity. There's a lot of transparency, so I feel like I know what's going on, I'm informed, I know why they've made the decisions, and I know the actions that they're going to take.
In the NICU in particular, we have sometimes some ethical and moral situations that we're not sure how to deal with at all times. And being part of the larger organization of Centura, we know that there are a lot of resources and people that we can turn to for answers.
When I woke up the next morning, I was greeted by Dr. Hoffer, who said, "I'm the guy who drove the truck that hit you last night." And I said, "Whoa, what happened?" He says, "Well, we had to operate. You had an aortic aneurysm, and Brian, you made it here just in time."
You know, fortunately, we do a lot of these types of procedures. It's a complex procedure, but one that we have a huge experience with.
I feel very lucky to work in an environment here with such a great group of people where we all work together as a team, and we can make Brian's stay and his hospitalization so much more of a positive experience for him.
I'll have to say I'm not a silent sufferer, and they cared for me, and the multiple requests for attendance without a complaint, with humor, and with professional attitudes.
Centura Health was formed when two healthcare organizations decided to join forces, Catholic Health Initiatives and Adventist Health System.
Each organization has provided quality faith-based healthcare throughout Colorado for more than 100 years. Both the Catholic and the Adventist organizations came to Colorado in the 1860s and 70s and established various healthcare ministries.
The Catholic Sisters formed ministries in the south part of the state, focusing on the underserved.
The Adventists came to Boulder and focused on wellness and prevention. These two ministries, realizing that their future success depended on banding together, decided to join hands and form Centura Health in 1996.
Today, the Catholic and the Adventist components of Centura Health Ministries are part of prominent national organizations. On the Catholic side, Catholic Health Initiatives, with more than 77 healthcare facilities in 20 states.
an Adventist health system with more than 37 healthcare facilities in 10 states. These two organizations now serve as national sponsors to their respective facilities in Colorado that comprise Centura Health.
The fact that Centura Health is a faith-based organization steeped in the Christian heritage does not mean that all of our patients, nor that all of our associates need to be Christian. What we're looking for in our associates are individuals who can express passion for self-giving service, that they can combine their professional skills with a heart of compassion.
One of the things I really enjoy is the second half of our mission statement, to nurture the health of the people in our communities. And we're able to do that because of our size. And we're able to donate more than $200 million a year in charity care back to the people in our communities.
For me, it is about the mission. It is about the nonprofit status of our organization. At the end of the day, what we do with any of the proceeds of the healthcare services we provide, we look at our communities and decide what else can we do as an extension of our mission to support people in our communities.
Nurturing the health of our communities goes far beyond the borders of Colorado. We're working around the world, in Asia, in Africa, in Latin America. We're working in areas which are poor and have great needs. We're working to train doctors, to provide community services, doing what we can to help support the health of those communities.
Up until 2009, Centura Health never had a system-wide strategic plan. Our CEO brought together over 300 key stakeholders who created a living document which we call today Centura Health 2020. It is based on 3 simple but powerful principles: strengthening our foundation, creating systems of care, and moving upstream to manage health.
If we don't have a strong foundation within Centura, it makes everything harder to pull together. Number one, we have to have a strong quality program where our patients see us as a high quality provider. We have to have a great convenience and service program where our patients realize coming to Centura, they're going to get the convenience and the service that they want and they expect from a top-notch organization. And finally, we have to be strong economically. If we don't have that economic strength where we are taking care of business, it makes the other two things hard. All those things have to be in balance in order to work and to have that strong foundation.
We've always had systems of care. Brian is an example of that, having moved from one facility within Metro Denver to another facility. We have now expanded that across the region. Whether you're down in Durango or all the way up to Cheyenne, Wyoming, we're able to provide systems of care. And those systems of care not only include cardiovascular, they also include neuroscience, oncology, trauma. So Centura Health is unlike any other system in the state of Colorado because we have the ability to provide a continuum of care. Whether you start off in one of our clinics, whether you're cared for in one of our acute care hospitals, whether you need health at home, or maybe long-term care, or maybe it is at the end of life where you need hospice care. A system of care is able to provide that same care throughout every stage of what a patient needs.
One of the ways that Centura will accomplish the moving upstream is by developing the health neighborhood. The health neighborhood will consist of pods of primary care physicians organized in patient-centered medical homes. They will be coupled with pods of specialty physicians into what we will call a health neighborhood. When you combine those pods of specialists and primary care physicians to hospitals, home care, and other services, we will have a clinically integrated network that's focused on really decreasing the cost of care, improving the outcomes or how healthy people are, and improving the satisfaction amongst our patients, and creating a healthy population. That is how we intend here at Centura to move upstream.
As Centura Associates, moving upstream means taking better care of ourselves. We want to be good role models for our patients, so we embody that by eating healthy, exercising, taking good care of ourselves, and being good role models for our community. If we take better care of ourselves, we're able to take better care of our patients. We've even coded this, Code You. It's a code to you to let you know it's time to take care of yourself and be that role model for our community.
I think that it's important to work for a system that cares about the people that are in the system, both internally in terms of the patients, but also the people who are providing the care. And I have seen episodes of where Centura or the organization itself is taking care of its people.
I work in accounts payable, and my house had recently burned down, and Centura came to my aid. They provided for my kids all of our clothing and all of their toys that they wanted, and they provided for me spiritually and emotionally also.
We expect a lot from our associates, but that seems to be what they want. We have high performers, so they like that level, that standard of behavior and that level of performance, and so we're fortunate.
You can't teach this two-way street between, how we treat our associates and how they give back in return, not only on a day-to-day basis, but with each other. It's just something that is a given. It's a calling. And there's no way to describe that, but you almost see the minute people come to work for Centura, they start embodying this.
There's a difference in hospitals. There's a difference working for Centura and other companies. Centura cares about their associates. They care about their patients. I can't imagine being anyplace else. I will retire with Centura. And that's no lie.
I'm so thankful to the Centura Health Organization for everything they've done for me. And I look forward to spending the rest of my life with my children and my family, and then someday walking my daughters down the aisle.